Good afternoon, ladies and gentlemen. I'm Bob Bennett. I am the COVID-19 Vaccine Operations Director here for the Unified Government of Kansas City, Kansas, and Wyandotte County. This afternoon, what we've got for you is essentially an awesome follow-up to what occurred yesterday when we brought a tour of folks to visit our mass vaccination facility here at the former Kmart at 78th and State. What you're going to see today is some remarks by Mayor Alvey. You'll get some discussion about the process that Julianne has led through the health department. And then you're going to get a chance to talk to three folks who received the vaccine today. Nicole Garner is one of our vaccinatees today. She'll be able to talk through her experience. Bianca Garcia also will be able to talk about her experience. She's also with the health department and has been with us throughout this entire crisis. And finally, you'll get a chance to talk to Kurt Nicholson, who was the very first recipient of the vaccine here in Wyandotte County today. He is a gentleman who volunteered on day one in this crisis and has been the person greeting every person coming through our test site to receive a clarification as to what their status is with the disease. And he is continuing that work now, both on the testing side and greeting folks as they come in for the vaccine. So initially, I'll turn it over to you, Mayor Alvey. Talk a little bit about what this day means for Kansas City, Kansas, and Wyandotte County, and where we're oriented to next.
Thank you. First of all, I just want to give a shout out and congratulations to the health department and to those in our building and logistics department, Unified Government Buildings and Logistics, as well as the folks at the Fleet Center. So many different departments across the Unified Government have stepped forward into the battle to try and get this vaccination site up and operational. And we were out in front of every community in the metro area. I think it just says so much about the dedication, the passion, the intelligence of so many people across the Unified Government to try and provide this service for our residents. It's a great example of what we really ought to be about during this season, and especially in relation to the pandemic. But again, this is a great sign of hope for us because we've waited so long for us to try and get back to normal. And we know that with all the different things we've had to do, whether it was the stay-at-home order or whether it was the mask order, these are the things that have been necessary just to protect ourselves and protect our loved ones and prevent community spread. But as we know, in Wyandotte County, we have a very high case rate. It's probably 50% higher than the case rates of surrounding localities. So we have a special interest in this. And I would say also, so many of our folks, work and don't have opportunities to not work, that they have to be out in the front lines doing this. So they're more likely to be exposed to the virus. This vaccine is just so important for us, especially so we get back to normal. So I'm looking forward to when it's my opportunity to get the vaccine. My motto, again, during this time of year especially, is if we just each person take responsibility to neither get nor give the virus, we can get back to normal much sooner. And so I want to say thanks to the health department, to all those departments across the Unified Government that have worked so hard to make this operational, but also and especially to the citizens, the businesses of Wyandotte County who have really taken a hit. We're fighting back now, and the vaccine is our best opportunity to fight back.
Awesome, thank you, sir. I know that we had that first moment this morning with Kurt receiving the vaccine. Julianne was jumping up and down. I think she almost blew a gasket there, and look at that. She's almost about to break herself smiling so big now. Ma'am, talk a little bit about sort of what this moment is for you and kind of what we're looking towards moving forward.
Thanks, Bob, and thanks everybody for being here today. It's hard to even put into words what this means for a team of people who have worked 12 hours a day, every day of the week, Saturdays and Sundays for 10 months. And so for them, this is about the public's health. Of course, this is about protecting Wyandotte County and moving us forward, but it's also about us as human beings. The staff of the health department are also mothers and fathers and sisters and brothers, and for them it's about starting to move towards normalcy in their lives as well. So on a personal and a professional and a public health level, all around, it's just an incredible moment of hope for us. I think our site out here at Kmart is incredible. We've had the assistance of a tremendous health department staff, along with all those other unified government folks that the mayor mentioned. This is truly a testament to what can be built in a short amount of time if you have a team that has a shared goal and wants to get it done. And they have done just that. So it is a beautiful site, ready to receive hundreds and hundreds of folks a day here shortly within the next couple of weeks. And then we will move on to 2 additional sites in our community as well to make sure that geographically this is available to our population across the board. So we couldn't be more excited. I couldn't be more proud as the leader of this team to see what the team has pulled off. And really, at the end of the day, this is about giving Wyandotte residents what they deserve, which is the best and access to this vaccine as soon as they can get it.
Awesome. I see Nicole nodding up and down very vigorously. Nicole Garner is, as I said earlier, one of our public health department employees. She's the person, quite frankly, that is bringing aboard the vast majority of the teammates as we expand to meet the need of 3 continuous sites. And ma'am, you got your shot today. Tell us a little bit about the experience and kind of what motivated you today to take this step and get this working.
Absolutely. Well, I will first want to say I'm just really excited to be here. And what really motivated me as a person of color, I want to lead by example. The ease of getting the vaccine was just that. I will admit I was a little nervous, but after going through the process, I'm super excited that I did it, and I'm happy that I did it. And again, as a person that is from this community, and again, as a person of color, I think it's important to lead by example. And so I can't be more happier to actually have experienced it. So I'm very happy.
Awesome. Bianca, you also received the vaccine today. Bianca, also one of our employees here throughout this process, has been engaging the problem and looking it right in the eye. How'd it feel today to strike back a little bit in your own way and get the vaccine?
I think it was a great experience overall. I'm not gonna lie, I was a little nervous, and I think most people are. But really doing the research and learning more about side effects and the development of the vaccines just helped me feel more comfortable and confident in being here today. I think the team, the vaccination team that's here on site, is incredibly friendly, welcoming, and I knew what was happening each and every step of the way. So that was really reassuring to me. I appreciated the recovery time after getting the vaccine and being able to sit there for a few minutes, knowing that someone was monitoring over us in case anything were to happen, a severe reaction. So I think overall I felt great about the experience. And like Nicole said, we really want to set the example. It's not an easy thing to make the decision to come and do this for yourself, but it's the important thing. We need to do this for us to move forward as a society and really combat the virus head on. And this, in combination with all the other public health guidelines that we've been hearing all throughout the year, it needs to be a collection of everything in order for us to overcome.
Awesome. We've got about 13 attendees today joining us from the media. And so at this point, those questions that you guys may have for all of our panelists, please use the Q&A function within Zoom to send those questions to us, and we will route them around. As we're waiting for those first questions, Mayor, obviously 54 vaccines delivered today, the first step of many. What's, I guess, your message to folks in terms of the confidence, not just in the vaccine itself, which I think you were pretty passionate about earlier, but about the process that we're going through and sort of the long-term prospect?
Yeah, no, that's a great question. I think what we've got to look at is our past experience with our health department and with all those in the UG who've really worked very hard to try and bring every measure possible to try and stop the spread and to protect our people. And so as soon as we receive more guidance in terms of the rollout of the vaccine, as soon as we get new information moving forward, we're going to continue to adapt and make sure we put the vaccine to its best strategic use. And so I'm very confident in that. You know, obviously it's clear we want to get the vaccine to our frontline emergency medical personnel, our first responders, and those who are forward facing to the public, those most at risk. Certainly those in long-term care facilities, especially staff. So those all are very wise, I think, prudential moves. And as we move further down the road and more vaccine doses become available, we'll continue to expand that. But I believe we'll continue to follow a process to put this to the best strategic use.
Awesome. One of the guys implementing that strategy, sir, just jumped on the screen there to your bottom left if you're in the viewing public. Kurt Robinson, or Nicholson, was in fact one of the very first people to greet all of our testing recipients and was the very first person in Wyandotte County to receive a vaccine. Tell us a little bit about your experience, sir, and then I'm going to have a couple of questions for our vaccine recipients coming from Kara and Fox 4. So first over to you, Kurt.
Okay, it was a very smooth experience. The shot was one of the better shots I've ever had, and I was glad to be a participant in the beginning of the end of this pandemic. So, I've been volunteering here since last spring, and it's just an honor to be a big part of this. Thank you. Mm-hmm.
Awesome. I guess we're going to start with Nicole and then over to you, Kurt. From Kara at Fox 4, talk a little bit about what it's like being in the trenches for the last several months. And after today's vaccine, what do you want to say to other folks about sort of the motivation behind that event or why it's important? Nicole, we'll start with you and then Kurt, over to you.
Sure. And I have been in the trenches for the last several months. And so for me, to get the vaccine, I did do my due diligence and did my research. And so for me, it's about seeing light at the end of the tunnel. And so it's exciting and it's something that is very important to me. And so again, I'm very excited, elated for not only myself, but for this community. And so what I would say to people that have the opportunity to get the vaccine, and when it is your opportunity to do the research, but if you have that opportunity to do it. And for those that look like me, don't be afraid. It's normal to be nervous, but don't be afraid and embrace this, because this pandemic has affected our community in a number of ways, and we want to get back to a sense of normalcy. And so the way that is going to happen is by getting this vaccination. And so that is going to, again, create that sense of normalcy that we're all wanting. And so that's what will have to happen. So,
cool. Kurt, over to you, sir. Same question. Talk a little bit about your perspective from the trenches to this point and what it means looking forward.
I think this is something we really all need to do to stop this pandemic from going on. And I've been volunteering there, like I said, since last spring, because, I want to help the community. And I think by myself and everyone else that can do it, when they can do it, to get this vaccine, it's going to help the community in a big way.
Awesome. Kurt, if you could pass the mic over to Bianca, we'll ask the same question for her. Note the fact, ladies and gentlemen, that we are in fact doing all of the appropriate things to keep folks safe here at our testing site. So please excuse us while we rotate our speakers on the panel from that room upstairs. Bianca, the question, having been in the trenches, as Nicole and Kurt have been for the last several months, what does this mean for your outlook in the pandemic, and how would you encourage other folks to get this vaccine?
Yeah, and I think, throughout the year, we've been working on, our division has been working on messaging and really getting the information out there as it developed, and things develop quickly. And so now that the vaccine has rolled out, we know it's going to be a similar situation. And it's sad to say, but unfortunately, most of the public towards the end of the year, we started to believe, okay, this is over, but then we see the rise in cases. So we know that's not the case. With the beginning of the new year, we still have to continue these efforts, and vaccination, like I said, is just another tool that we can use in combination with the other guidelines. It really needs to be a collection of everything that we've been taught thus far. And so really pushing forward and educating those around us, our family members, friends, our community, to know about the vaccine. Like Nicole said, do the research, share information that you find from credible sources, and then also just helping ease some of those fears as we move forward into 2021, because we really want the vaccination to be what brings us to the end. And it really is the light at the end of the tunnel, but it's just an additional layer of protection that we can add on to what we're already doing.
Awesome. Bianca, if you could swap out with Julianne real quick. We've got a question from Mary Rupert of the Wyandotte Daily. If Julianne
Okay.
could jump on the screen there.
Yeah, we'll go ahead and grab her for you.
Sweet. Her question is going to be when we will start vaccines for the general public. Obviously, the mayor alluded to the fact that this is a tiered system. We are currently focusing on those healthcare providers. Next week, we anticipate that we will be vaccinating our EMS and many of our frontline essential first responders who have been to homes to help evacuate people who are suffering from the disease to get them to our hospitals. So we'll be taking care of those folks next week. We'll also be getting ready to inoculate many of our medical professionals. Certainly those who work in the hospitals are being supported by those hospitals. We are taking care of the doctors and the nurses, the janitorial staff, and the folks that welcome you at your local doctor that you go to for every other need that you experience over the course of your life. So we'll begin that work immediately after we finish with those EMS professionals. And then from there, we'll continue on with the CDC guidance. And we'll have Julianne jump in on that. Oh, there she is. Hi, Julianne.
My apologies. Hi.
Hey, the question for you, and I just covered the phase 1 bits through the EMS and the healthcare professionals for next week. Mary Rupert from the Wyandotte Daily has asked us a little bit about vaccination start time for the general public.
Absolutely. Obviously, everything is up in the air at this point in time. It sounds like we may be able to start getting weekly allocations of the vaccine within the next couple of weeks. If that's the case, my hope is that mid to late January, we move into that 75 and older folks, and then the few specific sectors within the essential workforce. So that would include education, childcare, there's a few others, but really we have to follow the guidelines put out by KDHE. So we have to wait so that we know specifically what they're going to require.
Awesome. Related to that question, scaling that question, do we know approximately how many EMS and other healthcare workers will be able to vaccinate? They say per day. I'm thinking probably we can even roll that up into what we anticipate occurring next week and even the week after.
Yes, I'm hoping that next week we hit between 800 and 1,000 and then do another 1,000 the following week. So that we'll have between 2,000 and 2,500 done by the end of the second week of January.
And then also from Kara at Fox 4, if you are in the healthcare industry, how do you get on the list to come in and get your vaccine?
You contact the health department. So there's a lot of avenues to do that. You can call 311 to get connected to us. You can call our PIO, Janelle Friesen, and any of the media stuff that you've seen with her contact information. So what we've done is tap into the vast network of contacts that we have to reach out to healthcare personnel. We also tapped into Kansas Association of Dentists, Kansas Association of Family Practitioners, Kansas Association of Pediatrics. We've used every medical association that exists at the state level, and we've asked them to send information to everybody who's in their network from Wyandotte County. So we're really trying to tap into established networks to get as many folks as we can. But we know that there are people that we will miss. So those folks we ask, call the health department, let them know you're a healthcare provider needing a vaccine, and they'll direct you in the right direction.
Awesome. We still have 13 folks from the media present. Those of you who have questions, by all means, please submit them in the Q&A area of the Zoom link at the bottom of your screen today. Nicole, I know you've been putting together an all-star team out here. The first day I walked in the joint, I was absolutely blown away at the motivation, the quality, and the skill sets that you've reached out and brought in to this incredible facility. Talk a little bit about sort of what that experience has been like, and kind of what you see the big challenges being over the course of expanding to 2 additional sites.
Sure. It's been a surreal experience to actually see it. It's kind of sort of been in my head, and it's actually just not been just me, but it's been a whole team effort to really kind of put this masterpiece or put this team together. And so I think the challenges is just kind of getting all the bodies. As you all know, there's a nursing shortage and even a clinical shortage. So to try to get all the bodies together or all the nursing staff together for 3 sites, I think will continue to be a challenge. But I mean, I'm up for the effort. Our team is up for the work that it's going to take to run 3 sites here in Wyandotte County. And so I'm again up for the challenge, and it's going to happen. And so that's what we're going to do.
Awesome. We saw a note come in very quickly from Kara of Fox 4 asking about how many health department workers got the vaccine today. Do you want to handle that one, Julianne?
Sure. Today, we vaccinated about 50 folks who are on our site here at Kmart. So folks who have been participating in testing or who will be administering vaccines. And we've got a vaccine that'll move into the refrigerator tomorrow morning for next Monday, several hundred doses. So we'll be ready for a much larger group to come in on Monday, the 28th.
Awesome. I guess question for you, Mayor, looking at sort of what we discussed in terms of this call and the challenge that Nicole laid out in terms of getting the people here, but the remarkable way at which this particular site has met that challenge. Is that kind of what you expected when you assigned this mission to the health department? Or kind of, what does it tell you about the county itself, I guess?
Well, I think what's interesting is I think that would have been the instinct, frankly, or the consideration of the health department, even without any direction. But I will say that in our conversations with the pastors of the religious leaders of Wyandotte County, one of the concerns they had when we opened up the Kmart site as a testing center was what kind of public transit access. And of course, we have a bus stop right out in front. And so that's been a very great asset. That would have been one of the considerations anyway, because again, we're trying to serve all the members of our community. And so the public transit availability there was important. And as we move further east with another site and further west, I'm sure that will also be part of the consideration. But I do think that it indicates that the community understands the importance of the vaccinations, and they want to make sure that it's available to, whether it's in your people in your congregation, whether it's your family members, people who you work with, they all want to take care of one another to make sure that they can get the vaccine and get it without really any obstacles.
We just received another question on the Q&A line, so thank you all for very aggressively filling up that inbox. This certainly is helping us make this dynamic conversation something I'm learning from a great deal already. But a question primarily for Julianne. Other folks can weigh in. How are we going to let the public know when vaccines are available to the different tiers, and how they get their opportunity to do as Nicole, Kurt, and Bianca did today, and do their part in this pandemic?
That's a great question. We plan to use every single method available to us. So folks will start seeing things blasted in the traditional media and social media, of course, in direct mailing to households. We are also, again, tapping into various organizations who we know can reach specific populations. So right now we're very actively engaging organizations who serve those who are 75 and older, because we know that those will be one of the groups that hopefully has access in January. So for example, yesterday we had a very constructive meeting with Area Agency on Aging. So it's those sorts of partners who we know have a really direct line to specific populations that we're tapping into to put that message forward for us. So it'll be in the media, it'll be your friends and family, it'll be truly an entire population effort to help spread the words when the vaccine is available for specific folks.
And just to add to that, we really want to make sure that we have a really clear, concise messaging and a clear, concise drip campaign. And so the messaging will continue and be ongoing. And we are working really hard and diligently to make sure that that happens.
Awesome. Okay, we're almost at the point of the webinar here, based on the clock of the wall, where we should give some folks a chance for some final thoughts. Julianne, we'll start with you because I know you've got the rotating room there in the back end of the Kmart. So we'll go Julianne first, then we'll roll over to Nicole. Then we'll go back to Julianne's room for your other two folks in that room, and we'll close with Mayor Alvey. So Julianne, over to you initially.
Thank you. There's a lot of parting messages I'd like to share, but I think today this one goes to health department staff. This is a victory for a team of people who've worked harder than I've ever witnessed in my entire life. So all I have to say is thank you to an amazing team and to let them know that I am infinitely proud of them. Nicole, go ahead.
I would ditto that and say also to my amazing team, you've done a wonderful job. Also to people and that are hesitant and maybe scared and afraid to get the vaccine. I would say it's normal to be afraid, but again, do your research. But I encourage anyone that and when your time comes up to get the vaccine, we want to end this pandemic. And so please, please, when your time is up to get the vaccine.
Well, I definitely agree with all the final thoughts. I think that it really is going to take everyone feeling like they need to do their part to help us as a community move forward. And I do know myself, I had fears going into this, but research really helps. The reassurance of knowing you're not the only one, and there are other coworkers, other community members that are going to go through the same process as you. It's just great knowing that information. So it's important to continue to support each other as a community, to continue to educate each other, and really, like Nicole said, just put that consistent messaging out there, really provide the facts to those in the community to take the next step towards this.
So again, I want to offer my thanks on behalf of the people of Wyandotte County to our health department, to all those departments in the UG who have put together this site, this testing, the vaccination site, bringing this important weapon now in the battle against the pandemic. I know one of the special heartfelt prayers to those who have lost a loved one through the pandemic, those who have been ill themselves, those who are suffering through economic loss, financial hardship. There's just plenty of pain to go around, unfortunately, and we have to continue to focus that the virus itself is the enemy. Each one another is not the enemy. The virus is the enemy. We have to continue to see what the virus is, what it does, and do what we must to stop the virus, because it is bringing the pain to us. It is not one another. So let's remember that and keep our focus on winning this battle. I'm very grateful for all the work that's been done. I'm very hopeful for what we're going to be able to accomplish with widespread adoption of the vaccination.
And with that, ladies and gentlemen, this concludes our webinar for this afternoon. Again, if you have any additional questions, Janelle from our public information shop can absolutely help you to speak to any of our panelists in a different forum at a later time, or to clarify questions that you may have. Once we close this down, it will be saved and we will make it available on the UG website. And we will continue to use, as Julianne said, every possible avenue to engage our community and to overcome this enemy that we have in the virus, and to win this fight and get back to those things that we enjoy doing. We wish you all a very, very happy holidays from the old Kmart here at 78th and State. We look forward to every Wyandotte County citizen and resident coming to visit us here so we can stick a needle in your arm and take good care of you. Mayor, I'll let you send us out, sir.
So Bob, I guess want to say, if there are any blue light specials still at that Kmart, let me know. I have not bought a present for my wife yet. So.
Will do, sir. The blue light special right now is a vaccine, and we're working to get it to everybody.
Okay, well, all right.
All right, sir. Thank you all very much. Have a wonderful rest of your afternoon.
Bye-bye. Bye.